Hi, and welcome to Ask the Expert. I am Sara Carnes here with Dr. Wu today. Hey, how you doing?
I'm good. I'm good. Thanks for having me, Sarah.
Good. It is great to be here live on Facebook answering questions. We want to encourage anyone. Dr. Wu is a local periodontist. He's in our area. He actually has a private practice on the west side of Cleveland and on the south side of Akron. And we're going to be asking him questions. He's going to be answering. So it's Ask the Expert. So just go ahead and type in any questions you have. We're going to keep checking. But Dr. Wu, it's a pleasure to have you today. You're also an associate faculty member at Case School of Dental Medicine in the
Correct.
Department of Periodontics. So you have a ton of knowledge around this, and you're so great
Thanks.
to talk to. You're so easy to talk to. This is
Oh, you're too funny.
we've got to talk a couple times. So go ahead. I'm going to go ahead and get it started, and we'll let people chime in and get some questions answered. First of all, it's something that we never want to happen, but it does sometimes. We lose a tooth, whether it's our kids playing outside or an adult. Accidents happen. What are the options if I lose a tooth?
Great. So just beginning with, we're assuming that you've already been told you broke a tooth, it's got to come out. The three major options you have from best to worst or most optimal to least optimal, we first a dental implant, then a dental bridge, then a partial denture if you really can't qualify for either of the first two options.
So
Yeah.
what is a dental implant? So just
Yeah,
to
you know
refresh.
what? I actually brought my toys with me this time. So a dental implant really is just a screw in the jawbone. And it's kind of hard to see on this one, but I'll try to hold it up for you.
Okay.
But give me 1 second here.
It's always nice to see a visual.
So imagine if you lost a tooth per se here, and I'll hold it a little higher up.
Oh, there you go.
So obviously it's not actual size. We put the screw in the jawbone, you let that heal for 3 months, and then your general dentist would put on a middle connector like this that would end up sticking out a couple of months later. And then when it's all said and done, you get a single tooth replacement for a single tooth problem.
Okay.
It's pretty
Okay.
real.
So that's the process there. You come in, it's probably, was that like what, a 6-month process, maybe somewhere around there?
Yeah, it's 3 months after you pull a tooth to let the bone heal, and then 3 months after to let the implant heal once it's placed.
Okay.
But really quickly, a lot of people actually don't know what a dental bridge is, which is the next option. And this is what a dental bridge is. It's actually one piece of porcelain that looks like three teeth, and in real life, you'd be amazed about how real that looks. Like, not
Yeah.
that this comes up at dinner parties, but if you ever ask your friends, like, who has one, you'd be
You'd be shocked.
incredibly amazed. Yeah.
Okay. So I mean, I see the difference because that's a little bit different. It looks like there's three versus just the one. Is one better than the other? What would
Well,
be your options? How do you know which one to do?
I would say the dental implant is the most ideal. Kind of like I was saying, it's a single tooth solution for a single tooth problem. So if you broke one tooth, or if there's ever a problem with that implant or another tooth beside it, it's still kept separate. Whereas if it's a bridge, what happens is that you have to shave the teeth on either side, and it slides on top, which is great. But if anything happens to the tooth in front or the tooth behind it, you lose the whole thing, and you have to start over again. So that's kind of the downfall of bridges
So
in that sense.
is it one of those things where you just talk to your doctor, see what's best? Is there a cost difference?
Cost difference, yes. So, and I'm going to speak in generality of cost, and I'm going to assume that insurance does not play a role in this because there's hundreds of insurances. I would say a fair number from extraction, grafting, implants, like the whole thing for an implant, slightly over 5,000 at this point if you're a pure cash patient. If it's a bridge, you're probably looking at about 11 to 1,400 a crown. And
Okay,
again, these are in generalities.
sure.
So times three.
Okay, so a little bit different there. We do have some questions. One of them has something that I can't quite pronounce. So it's can you comment on it? It starts with PHOS inhibitors
Oh,
and implants risk. Do you see that
I'm
question?
I'm 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 wondering if she means bisphosphonates. Um, Bisphosphonates, if I'm hoping that's right, Alicia, that's what you're asking for. Bisphosphonates are generally used for osteoporosis, and I think what she's talking about is osteonecrosis of the jaw. So here's my stance on it. So back in the day when bisphosphonates like Fosamax, stuff like that, really came on the scene, it was great for the hips, it was great for osteoporosis. But the thing with that is that they found out that certain ones did get concentrated in the jaws and actually choked off the blood supply and caused the jaws to necrose during dental implants and whatnot, even dental extractions. Luckily, what we found is that one, it's not as common as we thought. Two, um, the pills are generally like the Fosamax pills versus the injectables. The pills generally don't cause that issue. So it's not a true contraindication, but we do bring it up as a higher risk level of complication. So yes, it's something to be aware of, but really once you're taking it, I always tell people, if your physician tells you it's good for your hips, I am not going to override that with dental implants. Just do what the physician says. It's more important to have better hips than a tooth issue.
Right,
Yeah.
right. Well, good, good. Vicky wants to know, do you have something temporary put in place in the front tooth over that 6-month period? Good question.
What that is a great question because every other than right now with the masks, everyone wants to know like, am I going to walk around kind of snaggletooth?
Yeah.
Yes, absolutely. There are temporaries. So
Okay.
when I work with my team, what we'll do is that they'll take a mold of your mouth first. They'll get a temporary made, and it's called a flipper. So it looks like a little orthodontic appliance with a tooth on the end of it. I pull your tooth, I put the bone graft in. You walk out with a temporary in your mouth. So you're never really walking around without a tooth.
Okay.
There are a couple other ways to do it, but generally the flipper is the number one way it's done. So, and it looks crazy aesthetic. Like people don't know
Right.
that, like, yeah, it's kind of weird.
Is it any different to eat?
Is it?
Like, can
It's
you eat as normal?
That's the bad part.
Ugh,
No. I tell people, look, it's temporary. You're gonna hate it, but you could smile. Like it's usually a wedding. I don't know why, but everyone's like, I need this done before the wedding. You'll get away with the wedding is smiling pictures, but eating, you're taking that out at dinner. I'll be upfront about that.
okay. Yeah. Well, that's
Yeah.
okay. We sometimes we have to do what we have to do, right? So we have some other questions here popping up.
Hey, Dr.
Um,
Showman, how's it going?
BJ says, I love working with Dr. Wu. So you already have a fan here. Um, let's see. David says, how much is the top and bottom dental implants? Is it safe?
Um, in regards to cost wise, we don't charge differently for a top implant or a bottom implant or a front implant or a back implant. The surgery itself is still the same as a dental implant placement. So it's not distinguished by position or type of tooth. Is it safe? It's very safe. Dental implants, modern day dental implants, have been around since the 1980s. You know, it
Okay.
has a huge track record. It has the best success rate in dentistry. Very, very, very safe. Yeah.
So Amanda kind of had a comment similar to that around the cost. She said, I just wish dental implants weren't so expensive. She said she got a quote for a full set for $60,000. And you have
Right, I read that, and she mentioned a company called ClearChoice. So I'll touch upon that. And I don't work for ClearChoice. I've never worked. I don't really know them very well. But their company specifically specializes in a thing called all on four or a full arch prosthesis. So you have to remember when you're talking about 60,000, they're talking about a type of procedure where they extract all maxillary teeth or mandibular teeth. If it's 60,000, they're talking about both. They're to pull them all, place 4 to 6 implants across, and screw in a full arch bridge. So, yeah, that's actually a fair price in regards to when people are like, well, how much does it cost? 60 grand, 30 grand an arch. That sounds about right. Unfortunately, it's a lot of technician hardware and a lot of implant hardware as well. Unfortunately. Yeah.
okay. Okay. We got another question. Let's remind everyone where you're located. You continue to ask questions, but I know you have two different locations.
Right. I'm located on the west side of Cleveland in Fairview Park, right across from St. Angela's, and also in Greene, Ohio, right off of the 77 241 exit. Yep, North Canton.
So I want to bring up also a question around dentures. Can
Mhm.
you get dental implants if you have dentures?
Oh, absolutely. And it's one of the major things that we do. Most
Hmm.
people think implants are like one tooth, one implant, one tooth, one implant.
Right.
But a lot of people come in saying, "Oh, I can't eat. My dentures keep falling." So what we do, and a lot of people don't know this, the screw that we put in the jawbone, it's actually hollow, and that hollow part has interchangeable attachments, kind of like Legos. So it doesn't actually have to be a tooth that goes on an implant. So for a denture, we could place the implants and we kind of put on these two button snap caps on top, the male ends that stick out, and it could actually clip a denture on. And actually, give me a second. I have one
Yeah.
of my fancy toys. So if you kind of look at this, this is, oh, where's my camera?
There
There
we
we
go.
go. Yeah. So again, imagine this is a upper jaw. You can't really, where's my orientation here? Upper jaw. Now this one happens to have four implants. And if you kind of rotate it, you'll kind of see it has these metal things sticking out. Those are the male ends of the attachment. And then this would be the denture. And the denture will have inside snap caps, just like that. And then once you pop it on, you'll hear, hopefully you'll hear a click. Uh, well, it kind of clicks in like that. And once it clicks in, it holds just like a winter coat snap cap. And then you'll be able to chew better, smile. You won't have to have that worry about. Everyone's seen that YouTube video where they blow the candle and the dentures come out. That doesn't happen. You know.
That would be a good thing. Sydney had a question, think tying into what we're just talking about here. She just want to know in general, how good are the denture implants?
They're great. On the bottom we generally place two, and it just stops anti-rotation. It really does help people chew and smile better. It's a great thing for people to. I always remember this one gentleman. He's like, you never miss chewing a steak until you can't. And
Yeah.
with implants, he's like he chews it doesn't rock everywhere, it doesn't rub. It really is a good service.
Yeah.
Absolutely.
What is your most common question, that anything that you hear a lot that we haven't covered today yet?
It usually is time frame, I would say. A lot of people think dental implants are quick. Um, if we can if we can get the implant in the same day as tooth extraction, that's great. Generally, that doesn't happen. So, like people think like, oh, I broke my tooth, and they come in like, I can't get it next week. Like it's pretty crazy. But so just time frame wise, you got to pull a tooth, and this is just usually how it goes. Pull a tooth, put a bone graft in there, and make sure the ridge is as healthy as possible. Wait 3 to 4 months, then place the screw in, and wait another 3 to 4 months. And the reason being is that's how long it takes for biology to let your bone cells migrate, get to where it needs to be, mature and harden.
Yeah.
People, and when people are surprised, like, oh, I can't do it any sooner. I always have that saying, it's like, you can't cheat biology.
Yeah.
You just have to wait. When you
Yeah.
break an arm, it's still 3 months. Like
Right.
that's just the way it is.
Yeah. Well, Luis has a question here. How can a person taking Fosamax be safe getting dental work done?
Very good. I'm assuming when they say dental work, they're probably talking about dental extractions or implants. Um, just remember, Fosamax is a bisphosphonate. It's taken by oral. It's taken orally. And again, it's good for the hips, but sometimes it causes vascular issues of healing in the bone. If it's a filling, you're good to go. If it's an extraction or an implant, we just kind of let you know, unfortunately, that you are at higher risk than a healthier person. But Fosamax has a multi-year half-year lifespan. So once you take it, there's no undoing that, which is a good thing and a bad thing if you think about it. You know,
Right.
yeah.
Right. And Barbara asked, what do implants that snap on dentures run? I think we were just talking about that.
Great question. And again, in regards to cost of implants, it doesn't matter if it's a front tooth, back tooth, or a denture. It's still considered an implant placement. Um, I always laugh because my manager always hates it when I try to quote things, but I'm going to do it anyway. She's going to be so angry. Uh, if there's no bone grafting, say you're in a denture already, and I just need to put in the implants, I believe it's roughly 2,200 per implant. Um, and again, if it's pure cash basis, no insurance, no write-offs, no reimbursement, stuff like that, coming out of the patient's pocket.
Yeah. So it's probably best to maybe call. You can probably give a little more directive based on all of those things that they
Oh,
have.
absolutely, absolutely. And and I know, speaking of the one thing that is like a lot of people want to ask is like, well, can't I just walk in and get the implant without a consult? This is one thing I will touch
Mm,
upon. There's a really important reason for a consult. We do a 3D scan, especially with denture patients. You don't know how much bone is left, you know?
mhm.
So I'm here saying, oh, yeah, we're just going to zip two in and don't worry about it. And then you come in thinking that, and all of a sudden you're like, you know how I said that? That's not going to happen. Now you need bone grafting. Now you need, like, so it's important to get the full picture before you really do. So, yes, consults are important as well.
Well, we're
Yeah.
getting ready to wrap it up here, but I have one more question. Give us, you said a success story about the guy like loving, like you never knew how much you missed chewing steak till you couldn't do it.
Yeah.
What's another just success story or a theme that you hear over and over from your patients? Like, oh my goodness, I'm so glad I did this.
With dental implant patients specifically, it really is surprisingly, it's not the front teeth people, because they expect to, they know how serious it is. They're like, oh, I can't walk around, I can't do this. Usually it's the functional people who are like, oh man, it's like I didn't realize I was breaking my front teeth without having back teeth, or like I couldn't believe I couldn't eat and enjoy my life. I was like, I didn't realize how much I was worrying about.
Right.
And again, it's always the weddings. Like it's like I didn't realize how much I worried about my events until I finally got this done, and now I realize how much I'm not worrying about just going out and having fun.
Yeah.
And that's what it's really about, just getting people back to enjoying life in that
Yeah.
sense.
That's
So
so
that's
true.
most rewarding. Great.
That's great. Cheryl did have another question. We just had that pop up. Does Medicaid cover costs?
Great question. Medicaid, I'm going to speak in generalities because I'm not a Medicaid provider. Medicaid will usually cover extractions. Unfortunately, it does not cover, usually does not cover implant type of treatments, bone grafting or implant placements. Correct.
Great. Well, thank you so much, Dr. Wu. Great questions today. You can continue to ask questions here, and Dr. Wu will follow up, or you could call his office directly. We've put all your information in comments below. You can call High Point Periodontics. We've given both numbers. You have an office again located in where Green and also in Westlake, right?
Fairview Park, but yeah.
Fairview Park. Okay, great. Well, thank you so much for spending some time with us. Ask the expert. You're always so easy to talk to. So if
Thank
you
you.
have any questions, go ahead and give Dr. Wu a call. And thank you for joining us
Great.
today.
Appreciate it as always. Thank you. All right.